as an excretory organ. It can function as a regulatory organ and also as a endocrine organ. Now coming to the function of kidney as an excretory organ. So what does kidney do is, the function of kidney is to filter the urea and other waste product from the blood. Okay, so they will filter the urea and certain harmful products or waste products from the blood, and they also remove the salts and excess water from the body, and they excrete them in the form of urine. So the main function is the elimination of waste from the bloodstream by production of the urine. So they, they also perform the hemostatic function, such as they will help in maintaining the function of extracellular fluid. They will help in maintaining the ionic balance in the extracellular fluid. They will help in maintaining the pH as well as the in the extracellular fluid, and they excrete the toxic metabolites such as urea, ammonia, uric acid, etc. from the urine. And all this excretion is done by the nephrons that are present in the kidney. And these nephrons, they act as a filter inside the kidney. So what does they do, nephrons? They filter the important materials and waste, and those important materials which are important for the body, they will go back into the bloodstream, and those materials which are not needed, they will be excreted as a urine. So in this way kidney functions as an excretory organ. The next function is as a regulatory organ. So kidney, they are, as they have an essential regulatory roles. For example, they will help in regulation of electrolytes. They'll help in regulation and maintenance of acid balance, and also they will help in regulation of the blood pressure. Now coming to another function, that is an as an endocrine organ. So as an endocrine organ, kidney, they produces three important hormones. Those are erythropoietin, calcitriol, which is known as vitamin D, and also they will produce the hormone that is known as renin. So they also synthesize the prostaglandins, which affect the many functions in the kidney. Now coming to erythropoietin, I think everybody knows that erythropoietin, it is a peptide hormone which regulate the erythropoiesis, that is the process to produce the RBCs, and calcitriol, which is a vitamin D. So this calcitriol, they will stimulate the small intestine for the synthesis of protein, and it will allow the absorption of calcium and phosphate from the intestine, and in this way calcitriol will help in the growth of the bone. And coming to renin, so renin, it helps in regulation of mineral balance in the body, as well as it will help to regulate the blood pressure. So kidney, it is a vulnerable organ because most of the drugs, or many of the drugs, they are excreted through the kidney. So they are vulnerable organ. They may be affected by certain drugs, and they are also exposed to high concentration of these drugs, or they are exposed to their metabolites, or both. And there are certain features that will allow the nephrotoxins to accumulate in the kidney, because kidney is highly vascular organ, so it may affect, so the nephrotoxins may affect the kidney, and most of the reabsorption of the most of the filtrates also occurs in the kidney, and so it may lead to nephrotoxicity and secretion of toxic drugs, as well as the metabolites of those toxic drugs that occurs in the kidney, which can lead to increase in concentration of intraliminal nephrotoxins. So nephrotoxins are those substances which produces nephrotoxicity. So these are the reasons for nephrotoxins to accumulate in the kidneys. Now coming to the definition of nephrotoxicity. So what is nephrotoxicity? Nephrotoxicity. So it is the toxicity in the kidney. It is the poisonous effect of some substance, both chemical substance or it may be a medications, and they may affect the renal functions. So the toxicity which is produced due to certain drug is called drug-induced nephrotoxicity. So drugs are the most common source of acute kidney injury. Most of the acute kidney or injury or most of the acute renal failure, these are caused by the drugs. Now, risk factor for drug-induced nephrotoxicity. So there are certain risk factors which may lead to nephrotoxicity. One is patient-related risk factor, and another is the drug-related risk factor. So coming to patient-related risk factor, uh, usually nephrotoxicity is most common in the older age group of patient because in older patient there is decrease in glomerular filtration rate, there is decrease in glomerular function. So those patients are more prone to develop nephrotoxicity and pre-existing renal disease. So those patients who already has a renal diseases in the past, they are more prone to develop nephrotoxicity in the future. And certain disease condition like diabetes mellitus, multiple myeloma, and proteinuria patient, that is those patients who passes increased amount of protein in the urine, those patients are more prone to develop nephrotoxicity. And another reason is exposure to multiple nephrotoxins. Those patients who are exposed to multiple drugs which can cause nephrotoxicity may develop nephrotoxicity. And another is underlying renal insufficiency. If the patient has renal insufficiency, history of renal insufficiency in the past, for example, if the patient is having glomerular filtration rate of less than 60 ml per minute, they may have nephrotoxicity. So normal GFR is usually it is 90 to 120 ml per minute. Okay, so normal GFR is 90 to 120 ml per minute. If the patient is having less than 60 ml per minute of GFR, they may be prone to nephrotoxicity. And another is certain disease condition like sodium retaining state like cirrhosis of liver, heart failure patient may be prone to nephrotoxicity, and the patient with severe dehydration and those patients who have volume depletion can also have nephrotoxicity. And another condition like sepsis, shock, and those patients with a history of renal transplantation can have drug-induced nephrotoxicity. Now coming to drug-related risk factors. So there are some drugs, they have inherent nephrotoxic effect. For example, like aminoglycoside is the most common drug that can cause nephrotoxicity, amphotericin B, cisplatin, and certain contrast dyes can also cause nephrotoxicity, while some shows nephrotoxicity on high doses and prolonged therapy. And some drugs if we use those drugs in very high doses and if it is given for prolonged duration of time, those drugs can cause nephrotoxicity. And if some drugs are given repeatedly in frequent frequency, those drugs can also cause nephrotoxicity. What are the clinical presentation of nephrotoxicity? What are the signs and symptoms that are seen in the patient having nephrotoxicity? So generally the most common manifestation is a decrease in the glomerular filtration rate. So there is decrease in GFR leading to rise in level of serum creatinine, and there is increase in the level of blood urea nitrogen. So uh, blood urea nitrogen, it usually comes from breakdown of protein in the food you eat. When you eat the protein in the food, it will be broken down and there will be formation of urea nitrogen. And normal normal blood urea nitrogen level is 7 to 20. And if there is increase in level of blood urea nitrogen more than 20, there may be nephrotoxicity. And the patient may present with history of malaise, that is weakness, anorexia. Patient may have history of nausea and vomiting. Patient may have difficulty in breathing, that is shortness of breath, and patient may have ankle edema. Okay, so these are the symptoms of nephrotoxicity, and patient may have history of decrease in urine output, which is the early signs of nephrotoxicity. Patient will complain that patient has been passing very decrease in amount of urine per day, and usually uh, nephrotoxicity may be due to radiographic contrast media, that is contrast dye that we use in the patient, and certain NSAIDs can cause nephrotoxicity, ACE inhibitors with the progression of volume overload. If the patient are taking these drugs, they may have decrease in urine output along with volume overload as well as history of hypertension. So these are the clinical presentation of nephrotoxicity. Now, what are the syndromes of nephrotoxicity? So when the patient is having nephrotoxicity, patient may have acute renal failure, patient may have chronic renal failure, as well as patient may have nephrotic syndrome. So what do you mean by acute renal failure? So what happens in acute renal failure is it occurs when your kidneys suddenly become unable to filter the waste product from the blood. In acute renal failure, it is a sudden onset, it occurs suddenly, and the kidneys will be unable to filter the waste products that is present in the blood. And when kidney lose their filtering ability, then there will be increase in level of waste material, and it may accumulate, and the body's chemical makeup will be getting out of the balance. For example, if patient is having severe diarrhea and vomiting, and patient is having sudden dehydration due to diarrhea and vomiting, patient may have acute renal failure, and patient may present with signs and symptoms of decrease in urine output. Patient may have history of ankle edema. Patient may have history of shortness of breath along with history of confusion as well as generalized body weakness. So these are the symptoms of acute renal failure. Now coming to chronic renal failure. So as you know, acute renal failure, it is sudden in onset, whereas chronic renal failure, it develops slowly over a period of time. So chronic renal failure, it is a condition involving decrease in the kidney's ability to filter the waste as well as decrease in ability to filter the fluid from the body, and it usually develops over a period of time, and chronic renal failure are not reversible. Okay, acute renal failure can be reversed back, but chronic renal failure, they are not reversible. It is also known as CKD, chronic kidney diseases, and it is usually caused by certain diseases like diabetic mellitus, hypertension, etc. And in chronic renal failure, patient may be presenting with shortness of breath, history of tiredness, body edema, and blood in the urine, and patient may have itchy skin. And another is nephrotic syndrome. So nephrotic syndrome, it causes the body to pass too much of protein in urine. So patient with nephrotic syndrome may have history of proteinuria. Patient will pass increase in amount of protein in the urine, and it is usually caused by damage to the clusters of small blood vessels that is present in the kidney, which filters the waste material as well as excess water from the blood. And patient with nephrotic syndrome may have history of decreased urine output, increase in blood pressure, etc. Now, coming to major mechanism of drug related nephrotoxicity. So that how does drug cause nephrotoxicity? So there are basically five mechanisms. Number one is alteration in the intraglomerular hemodynamics. There is change in the hemodynamics inside the kidney, and there may be hypersensitivity reaction or allergy reaction that may cause drug induced nephrotoxicity. Another is obstructive nephropathy, and number 4 is tubular necrosis, and number 5 is the rhabdomyolysis. Now coming to number 1, that is hemodynamically mediated. So, in condition when there is decrease in renal blood flow, the intraglomerular pressure is usually maintained by vasodilatation of the afferent arteriole. So, what is the role of afferent arteriole? So, afferent role of afferent arteriole is to supply the blood to the kidney. So, whenever there is decrease in the renal blood flow, how it is how the intraglomerular pressure is maintained is by dilatation of the afferent artery. So when afferent arterioles are dilated, there will be increase in the blood flow towards the kidney. And another is there is vasoconstriction of the efferent artery. So efferent artery will take the blood away from the kidney, isn't it? So when there is constriction of the efferent artery, there will be increase in blood flow to the kidney. So normally, when in the situation when there is decrease in renal blood flow, the intraglomerular pressure is maintained by dilatation of the afferent artery, so that increase in the blood flow is present in the kidney and by constricting the efferent arterioles. But in the condition where drugs are involved in hemodynamically mediated nephrotoxicity, it leads to decrease in the renal blood flow and pressure. So how does drug decrease in the renal blood flow? So drugs which may cause nephrotoxicity will cause constriction of the afferent arteriole, or it may cause dilatation of the efferent arteriole. So when there is constriction in the afferent arteriole, there will be decrease in the blood flow to the kidney, and whenever there is dilatation of the efferent arteriole, then there will be increase outflow of the blood. So in this way, the drugs that cause nephrotoxicity will cause further decrease in the blood flow to the kidney. So there are certain drugs that can cause nephrotoxicity are NSAIDs group of drugs, ACE inhibitors, and angiotensin sorry, ACE inhibitors and ARBs, and another groups are immunosuppressant drugs. For example, cyclosporin. These are the drugs that may cause nephrotoxicity. Now coming to number 2, that is hypersensitivity or acute allergic interstitial nephritis. So it is acute allergic interstitial nephritis, that is AIN. It is an inflammatory condition that affects the renal tubule as well as renal interstitium. So what happens here is it occurs as a hypersensitivity reaction to medications. Whenever patient is taking some medicines, patient may have hypersensitivity reaction to those medicines. So what happens here is the drug metabolite, it will bind to antigen that is present in the kidney, or it may itself act as a antigen, and these antigen are deposited into the renal interstitium, and these after being deposited into the renal interstitium, it will induce an immune reaction, and due to immune reactions, patient may be having following signs and symptoms like there may be a clinical picture of AIN, that is patient may have history of fever, history of rashes, and there may be eosinophilia, that is patient may have increase in eosinophilic count due to allergic or hypersensitivity reaction. There may be history of dysuria, that is difficult, that is pain while passing the urine. Patient may have history of dysuria and back pain. There may be history of nausea, vomiting, fatigue, as well as weight loss, and sometimes patient may have history of hematuria, that is passage of blood in the urine. So these are the signs and symptoms due to hypersensitivity reaction to the drugs. So drugs that cause interstitial nephritis are penicillin and cephalosporin group of drugs, sulfonamide, uh, then diuretics like furosemide, bumetanide, thiazide group of drugs, antitubercular drug like rifampicin, it can cause interstitial nephritis, ciprofloxacin, NSAIDs group of drug, lithium, PPIs like omeprazole and lansoprazole can also cause interstitial nephritis, and antiviral drug like indinavir can cause interstitial nephritis as well as streptokinase, which is a thrombolytic agent. It can also cause interstitial nephritis. Now coming to number three, that is obstructive nephropathy. So obstructive nephropathy, usually it occurs due to obstruction in the urinary system. That is, it there may be obstruction in the kidneys, or there may be obstruction in the ureter, or obstruction in the urinary bladder, or there may be obstruction in the urethra. So drugs precipitate depends upon the urinary pH, and they form the crystal. So when we take the drug, depending upon the pH of the urine, they may form the crystals. So mechanical obstruction are due to crystal formation in the renal tubules or ureter. So depending upon the urinary pH, the drugs which we have been taking for certain disease condition, those drug will accumulate and they form the crystal, and they may obstruct the urinary tubule, or they may obstruct the ureter, or they may obstruct the urethra. So when there is obstructive nephropathy, patient may have features like renal colic. That is the type of pain you get when urinary stool blocks the part of your urinary tract. That is known as renal colic. Okay, patient may have, if the patient is having obstruction, or if patient is having uh, urinary stone in the ureter, patient may have flank pain along with excessive vomiting and followed by hematuria. Patient may be passing red color urine, and the crystals in the urine may be needle shaped in the patient who has been taking the drug acyclovir, or patient may have rectangular shaped crystal in the patient who has been taking the drug, antiviral drug, that is indinavir. So the drugs that cause obstructive neuropathies are sulfonamide group of drugs, acyclovir, foscarnet, ganciclovir, indinavir, methotrexate, triamterene, and acetazolamide. These are the drugs which may cause obstructive uropathy. So what happens in obstructive uropathy, where if there is obstruction in the urinary system, there will be inadequate flow of the urine. Like obstructive uropathy, it is a condition when urine cannot flow. Either it may be partial flow, or it may be completely obstruction through the ureter. So urinary bladder, there may be obstruction in the ureter or urinary bladder or urethra due to some obstruction. So instead of flowing from the kidney to the bladder, uh, normally what happens, urine flows from the kidney to the bladder and then to the urethra. But if there is obstruction, instead of flowing the urine from the kidneys to the bladder, what happens, urine will flow backwards, or there will be reflux of the kidney, and kidney become swollen. And that when the kidneys become swollen, it is known as hydronephrosis. For example, there is a water tank in the roof of the house, isn't it? So when the water tank is filled up, normally what happens, the water flows from the tube into the different rooms of the house. So when there is obstruction in the tube of the water tank, what happens, if you fill the water in the tank will be overflowed. Okay, and the water cannot go down due to some obstruction in the tube. In the similar manner, if there is obstruction in the ureter or urethra, what happens, the urine cannot flow into the urinary bladder or urethra, but what happens, urine will be flown backwards, or there is reflux of the urine backwards into the kidney. Due to reflux of the urine backwards into the kidney, there will be swollen of the kidney, and the condition is known as hydronephrosis. Now coming to another condition, that is tubular necrosis. So tubular necrosis, it affects the renal tubules, and it may induce the cell injury, or it may cause the death of the renal cells. And due to drug, it may be due to drug itself, or it may be due to the toxic metabolite, accumulation of the toxic metabolite of that drug. For example, these are the drugs that may cause tubular necrosis. The most important drug is the most common drug is aminoglycoside group of drug, amphotericin B, that is antifungal drug, vancomycin, radio contrast dye, and cyclosporin. These are the drugs that may cause tubular necrosis, and mainly the proximal convoluted tubules are more commonly affected in the case of tubular necrosis. So, how does aminoglycoside cause tubular necrosis? So, what happens here is when we take the aminoglycoside, it will bind to the membrane of the proximal convoluted tubules. So, after being bounded to the membrane of the PCT, it will be endocytosed. That is, substance are brought into the drugs are brought inside the cell. So, there will be endocytosis and accumulation in the drugs will be accumulated in the lysosomes, and it will interfere with the normal function of the lysosomal enzyme. And since there is interference in the function of the lysosomal enzyme, the undigested phospholipids which is originated from the turnover of the cell membrane, will again accumulate, and there will be rupture and release of lysosomal enzyme. There will be release of phospholipids and aminoglycosides into the cytosol, and it will interfere with the function of the cellular and mitochondrial function, leading to cell necrosis, that is the death of the cells or tissues. And another is amphotericin B. So amphotericin B also causes tubular necrosis. So it causes tubular injury by inserting into the cell membrane. It will go inside the cell membrane and forms the pores that increase membrane permeability. So when we take amphotericin B, it will insert into the cell membrane, and there in the cell membrane they will form multiple small pores in the cell membrane. And what happens from that pores, the intracellular contents of the cell membrane will be leaked out. So when there is leakage of intracellular components like calcium, phosphate, etc., there will be death of the cells. Now coming to vancomycin, so usually vancomycin is an antibiotic which is used in methicillin-resistant staphylococcal aureus infection, and these vancomycin, when it is taken, they also are accumulated in the kidney and they cause acute renal failure. And the mechanism behind the renal failure is there will be increased production of reactive oxygen species, and there will be oxidative stress which will lead to renal tubular ischemia. There is decrease in renal blood flow leading to acute tubular necrosis. So what is reactive oxidative species? So reactive oxidative species is the unstable molecules. These are the unstable molecules that contain oxygen, and since they contain oxygen, they can easily react with the other molecules that are present in the cell. So when they react with the molecules that is present in the cell, it may cause damage to the DNA, it may cause damage to the RNA and proteins. So when there is damage to the RNA, DNA and protein, it causes the cell death. Okay, so reactive oxidative species, they are the free radicals. They are also known as oxygen radicals. And so whenever there is increased production of reactive oxygen species, there is oxidative stress. So what is oxidative stress is? It is a phenomenon which is caused by an imbalance between the production and accumulation of the oxygen reactive species. So it is an imbalance between the production and accumulation of the reactive oxygen species in the cells and tissue, and the ability of biological system, there is decrease in the ability of biological system to deoxify the reactive oxygen species. So whenever there is production of the reactive oxygen species, there is oxidative stress, and due to production of oxidative stress, there will be decrease in the blood flow to the kidney, leading to renal tubular ischemia. And whenever there is decrease in renal blood flow, it can lead to acute tubular necrosis, that is the death of the tubular cells. Now, last is rhabdomyolysis. So, rhabdomyolysis, it is a syndrome in which the skeletal muscles injury, whenever there is skeletal muscles injury, it will lead to lysis of the myocyte, that is the breakdown of the myocyte. So it is a condition in which skeletal muscle injury can lead to lysis of the myocytes, and whenever there is lysis of the myocyte, it causes release in the intracellular contents including myoglobin as well as creatinine kinase into plasma. So whenever there is rhabdomyolysis, we can see increase in level of creatinine kinase and myoglobin in the plasma. And this myoglobin, it will cause renal injury secondary to direct toxicity, or it may cause renal injury secondary to the tubular obstruction. So how does it cause direct toxicity? Is the direct toxicity from the ferrihemate, which is the ferrihemate, it is a product of dissociation of myoglobin, which occurs at pH of less than 5.6. And another is it may cause renal injury by tubular obstruction. So tubular obstruction is caused by myoglobin cast. There are small cast or crystals of myoglobin which will obstruct the renal tubule. And patient with history of rhabdomyolysis will have features like weakness. There may be myalgia, that is generalized body ache, and patient may pass the typical tea colored urine. There is a history of passing of tea colored urine in the patient having rhabdomyolysis due to the lysis of myocytes. And the drug that cause rhabdomyolysis is most common drugs that cause rhabdomyolysis is statin group of drugs. So statin group of drugs, these are the hypolipidemic drug like atorvastatin, simvastatin, etc. And another group causing rhabdomyolysis is heroin. So these are the drugs that causes various nephrotoxic condition like acute tubular necrosis. It is caused by aminoglycoside amphotericin B vancomycin, and interstitial nephritis are caused by penicillin, cephalosporin, cotrimoxazole, various diuretics, antitubercular drug, NSAIDs, PPIs, etc. And hemodynamically mediated nephrotoxicity are usually caused by NSAIDs group of drug, SE inhibitor, ARBs, and cyclosporine, whereas tubular obstruction are usually caused by uh, antiretroviral drug like indinavir, tenofovir, antiviral drug like acyclovir, uh, sulfonamide, triamcinolone, and methotrexate, whereas rhabdomyolysis it is caused by statins as well as cocaine and heroin as well. So these are the list of nephrotoxic drugs. So you may be asked during the viva to name the nephrotoxic group of drugs. So these are the drugs like analgesics, acetaminophen, aspirin, NSAIDs. Usually acetaminophen, it is a paracetamol, it is a safe drug, but when it is taken more in the dose of more than 8 gram, then it may affect the kidney or it may affect the liver as well. Otherwise, it is a safe drug. So another is antimicrobial drug like aminoglycoside, amphotericin B, beta-lactam antibiotics, sulfonamides, and vancomycin. Antiretroviral drugs like indinavir, cidofovir, acyclovir, and immunosuppression drug like cyclosporin and tacrolimus. Cardiovascular agents like SE inhibitor, ARBs, clopidogrel, and ticlopidin, and chemotherapeutic drugs like cisplatin and methotrexate can cause nephrotoxicity, and diuretics like lip diuretics, thiazide diuretics, and triamcinolone can cause nephrotoxic effect. A drug of abuse like cocaine, heroin, amphetamine also can cause nephrotoxic effect, and certain PPIs like lansoprazole, omeprazole can cause, and other drug like rifampicin, heavy metals, gold therapy, anti-epileptic drug like phenytoin, uh, zoledronate, pamidronate, quinine, and certain contrast dyes can be the causative agent to cause nephrotoxicity. So whenever uh, we are planning to give certain contrast dyes, radiographical contrast dyes, if you are planning to give it to the patient, the most important thing you have to do is we have to see the renal kidney parameters, because if there is certain changes in the kidney parameters, we can't give the contrast dyes because it may further worsen the condition and may cause nephrotoxicity. So before giving any contrast dyes, we have to see the kidney parameters like sodium, potassium, urea, and creatinine level has to be checked before uh, injecting the contrast dyes. Coming to prevention, how can you prevent the nephrotoxicity of the drugs? So it can be prevented by using equally effective but non-nephrotoxic drugs whenever possible. So whenever possible, try giving the non-nephrotoxic group of drugs. And if there is risk factors for nephrotoxicity, you have to correct the risk factors like if patient is having diabetes mellitus, uncontrolled diabetes mellitus, we have to control the blood sugar level. We have to control the blood. If patient is hypertensive, we have to control the blood pressure, etc. So we have to correct the risk factor that can cause nephrotoxicity. We have to assess the baseline renal function before initiating the therapy. If you are planning to give some antibiotic that may cause renal failure or that may cause nephrotoxicity, we have to assess the baseline renal function. Like I have already told, we have to see in renal function test, we can check for urea, creatinine, and sodium and potassium level. And we have to adjust the dose of medication for renal function. We have to give the correct dose to the patient. Or if we give the high dose of the drug, it may affect the renal function of the patient and can cause nephrotoxicity. And avoid nephrotoxic drug combination. We shouldn't combine the nephrotoxic drug together. So we have to avoid the combination nephrotoxic drug. And whenever patient is taking the drugs, we have to advise patient to be well hydrated. We have to influence the patient to take increased amount of fluid. So adequate hydration is important to maintain the renal perfusion and to avoid drug induced renal impairment. So whenever patient is taking any drug, we have to tell the patient to take increased fluid intake so that it can maintain the renal perfusion and it can avoid the drug induced renal impairment. So these are the general overview of the nephrotoxicity of the drugs. Okay, that's it for nephrotoxicity. Thank you.